Dysarthria is a speech disorder that happens due to the weakness of the speech muscles. It occurs due to neurological injury to the motor speech system. Dysarthria is a type of motor speech disorder. There is another term called anarthria. It is a severe form of dysarthria. It may affect any group of muscles which helps in speech production. These may include muscles of breathing, throat, tongue, and face. Patients with this speech disorder have difficulty in using the subsystem of speech. These are respiration, phonation, resonance, articulation, and prosody. Structures involved in the speech system include the following: respiratory muscles, larynx, pharynx, velopharynx, tongue, jaws, facial muscles, and lips. Dysarthria is a speech disorder while aphasia is a language disorder. An aphasic client may have difficulty in understanding, expression of language or both. Aphasia does not have muscle weakness like in dysarthria. Here are the symptoms of dysarthria. Patients with this disorder exhibit difficulty in speaking, and we can call it dysarthric speech. This difficulty depends on the severity of the problem. Their speech may have the following characteristics: mumbling, breathy or whispering-like voice, poor intonation, poor intelligibility or articulation, hyponasality or hypernasality, hoarseness of voice, gurgly voice, speech may be fast or very slow, voice sounds unnatural, poor control on the loudness of the voice. Let's move towards the causes of dysarthria. Several neurological conditions can result in dysarthria. We can divide them into two categories: developmental, like cerebral palsy, Down syndrome, etc. Acquired, like stroke, brain tumor, head injury, Parkinson's disease, etc. Former one occurs before or during birth, while the later one can happen late at any age. These conditions affect the motor system, which controls the muscles of the speech. This may affect the muscles' tone, movement, strength, and range, thus affecting the speech of the patient. Now, I am going to explain the different types of dysarthria. We can divide this disorder into the following categories. Number 1 is spastic dysarthria. It happens due to damage in upper motor neuron, UMN. The following are the signs of this disorder: a slow rate of speech, poor articulation, nasal air emission, breathlessness, and audible inspiration. The second type is flaccid dysarthria. It occurs due to the lower motor neuron lesion, LMN. The characteristics of flaccid dysarthria are as follows: hypernasality, nasal air emission, breathiness, and audible inspiration. Next is hypokinetic dysarthria. A lesion in the extrapyramidal system causes hypokinetic dysarthria. It can exhibit the following signs: decrease and mono loudness, mono pitch voice, and rushes of speech. Next on the list is hyperkinetic dysarthria. Hyperkinetic dysarthria also occurs due to the lesion in the extrapyramidal system. Have a look at the symptoms: variation in the precision of articulation, hypernasality episodes, loudness variations, and interruption in phonation. Another type is ataxic dysarthria. Damage to cerebellum can cause ataxic dysarthria. Characteristics of ataxic speech is as follows: phoneme prolongations, inappropriate rhythm, increased stress, a slow rate of speech, and loudness variations. Mixed dysarthria also exists. The lesion in multiple motor systems can cause mixed dysarthria. Here are the characters of this type: monopitch, reduced stress, monoloudness, harshness, and strangled voice, imprecise articulation, the slow rate of speech, hypernasality, and inappropriate prosody. Assessment of dysarthria can be done through Dysarthria Profile. A speech pathologist assesses dysarthria. Usually, SLP applies Dysarthria Profile for assessing the clients. Have a look at different aspects of assessment: respiration, phonation, facial musculature, diadochokinesis, articulation, intelligibility, rate, prosody, and communication competence. Here is a question. Please visit the link in description where you can find assessment procedure of dysarthria. Let's talk about dysarthria treatment approach. After the assessment, the therapist makes a treatment plan. It depends on various factors. For example, severity, medical condition, age, type of dysarthria, etc. Speech pathologist starts working on all the parameters. For instance, breathing exercises, phonatory exercises, strengthening of muscles including the tongue, lips, cheeks, jaws, etc. Work on diadochokinesia rate, activities for precision in articulation of sounds, words, and sentences, tasks for intelligibility, work on prosody, that is rhythm, stress, and intonation, and alternative augmentative communication, if necessary. These tasks will help to cope with different challenges like breath control, muscle tone, voice quality, muscle strength, natural voice, range of movement, speed of the movement and pitch of the voice. Counseling and interaction with patients' caregivers is another important aspect of the plan. A clinician will give home tasks for better progress. I have few tips for family who are taking care of a dysarthric patient. The family members need to support the client during the treatment. Until the client gets better, you should follow some instructions. Always try to motivate the client for exercises and activities throughout the plan. Appreciate his efforts. Do not interrupt while a client is talking. Don't speak before he completes it. Make the environment comfortable for speaking. Make sure the client gets enough time to talk to avoid tiredness. Ask the client to speak in his comfort zone without being hasty and anxious. Use of gestures, writing, and images to assist in the conversation. Stay with the client and assist him during social interaction. Well, dysarthria is a common speech disorder after neurological injury. Both adults and children can be affected by this disorder. It is important to start speech therapy as early as possible. Progress is better with early dysarthria treatment.
Do not forget to share your thoughts about the video in the comment section. See you again, goodbye.